this is my idiot-proof guide to acne treatment. Now, an effective skincare system for acne-prone skin is a very rational one where every element has purpose. So to think about therapeutic steps, we need to think about what causes acne in the first place. So going back to basics, the first thing that happens is that the pores start to get clogged by sticky skin cells, which rather than exfoliating off smoothly and disappearing, they tend to clump, forming these little clogs called comedones at the opening of the pore. The second thing that happens is that underneath the pore in the sebaceous gland, where oil is produced, we get too much oil basically, and in someone who's acne prone, it tends to be a bit gloopier than somebody who's not prone to acne. So it's been likened to oil like brie in someone who suffers from acne, whereas someone who doesn't, it's more like olive oil. So that combination of blocked pores, too much gloopy oil, means that the bacteria that promotes acne, called P. acnes, flourishes and has a party down there in this oxygen-free environment of the hair follicle. And what that leads to is an immune response, and that will determine whether someone gets a teeny tiny bump or a massive raging nodule or cyst. So when you think about those steps, you understand why you need active agents to tackle each part of the process. So that means that we need agents that unclog the pores, and we need agents that are anti-inflammatory, we need agents that are antibacterial, and ultimately when you get an inflamed spot, invariably you get a dark mark left behind, so you need agents that tackle those as well. Now, the good news is that many of the ingredients that we use for acne do more than one thing, so it's not as complicated as it might sound. So in terms of agents that help stop our skin clogging, it's pretty simple. We're looking at using either retinoids, and by that I mean the family of molecules that are derived from vitamin A, and that means retinol, retinaldehyde, retinol retinoate, and then prescription agents like adapalene and tretinoin. A good alternative to that is azelaic acid. Agents which are antibacterial include benzoyl peroxide, which is a bit of an elusive product to get hold of in the UK at the moment, and also on prescription or topical antibiotics. Agents that reduce inflammation, again we're looking at benzoyl peroxide, but also salicylic acid. And then finally, agents that help eliminate the dark marks that occur from acne spots include azelaic acid, alpha hydroxy acids, and to some extent also retinoids. So we're going to look at some of my favourite topical products over the counter. So we're just doing over the counter products today for treating acne. So for me, it's quite simple. Most people will be using a retinoid. Really, the only exception to this are those who also have coexistent rosacea or are pregnant. So because retinoids have to go on the skin at night, that's when we have to use them. And that then frees up the morning part of your skincare routine for the anti-inflammatory, antibacterial part of your approach to acne. So it's very logical. Now, in terms of topical retinoids, I have a few of my favorites here. We have this one from Avene called TriAcnèal, which contains retinaldehyde. So I find this to be very well tolerated and is a great way to start treating your acne without having to resort to the stronger prescription grade products. A good alternative to that is Medik8. They do this great system of retinols, different strengths. You can build up your tolerance gradually over time. Finally, I'm also a fan of Roche-Posay's Redermic R. So those are your nighttime options. For daytime, I like to use products that combine more than one of those anti-inflammatory, antibacterial agents that we mentioned. Now, at the moment in the UK, as I said, benzoyl peroxide is hard to get hold of. So the one product that is available through most chemists is Acnecide, which is a 5% benzoyl peroxide cream or gel. Obagi also has one called Clenziderm, which is a 5% benzoyl peroxide preparation. However, for some people, benzoyl peroxide can be too harsh. This is a common finding in adult acne where skin can be dry and more sensitive behaving, in which case ingredients like azelaic acid and niacinamide and salicylic acid are good alternatives. Now, this is a great product that was a recent discovery from Glo-Therapeutics called Dual Advantage Cream, which is 10% azelaic acid combined with niacinamide. Now, the niacinamide is anti-inflammatory and also helps with dark marks. It's also quite good because it boosts barrier function, because it increases the production of ceramides. That can make it easier for you to tolerate all the other things which can be a bit irritant when it comes to treating acne. So that's quite an unusual product. It's rare to get a product over the counter with 10% azelaic acid, so that's a good find. Then we have this product from Medik8 called Beta Gel, which is again a blend containing azelaic acid, niacinamide and salicylic acid. So good for tackling active spots, but also good for helping improve the appearance of the dark marks that spots leave behind. And then finally, a really gentle but effective inflammatory acne solution from La Roche-Posay called Effaclar Duo Plus, which also contains beta-hydroxy acid and niacinamide. So those are good options for your morning routine. I think it's important to recognize that whatever you use, there is potential for some irritancy. So given that, to have realistic expectations about how you're treating your acne, you need to be looking for improvement over the course of months, not days, and probably not even weeks. It makes sense to go slow and steady and build up your use incrementally, because that way your skin will accommodate and you'll find that over time you're able to tolerate more product. So I'm rather boringly pedantic about this. I get all my patients to quantify exactly what they're using. And I will literally show them what I mean by 0.5 gram of product, which I think is a reasonable target. I've ruined so many silk blouses doing this, but it's worth it. So just so you can see, a line as if toothpaste is coming out of the tube, as long as the fingertip from the crease is about 0.5 gram. A reasonable amount to start with is half that quantity, so 1/4 gram. Applied to cleansed skin and applied all over, so not just on blemishes, which is a key rookie error. That will just cause redness and irritation and probably a patch of eczema as well as a spot. So applying it all over, obviously excluding the area around the eyes, not going too close to the lips and avoiding build out at the creases of the nose. And I tend to recommend doing the treatment step every other day for the first 2 weeks. So your morning step on a different day to your nighttime step until you get used to things. At 2 weeks, if you're comfortable, try every day, morning and night. If okay, after 2 more weeks, try doubling quantity so you're using your full target dose. If you're irritated, don't. Hold fire, keep going at the level you were using it previously. For me, that is the key way to get yourself using the right amount of product over the right amount of time and to carry on having livable skin. So that's it. You've got your fire extinguisher step in the morning, your preventer step at night, and over time you can expect to see slow but steady progress in your acne.